Coming up, we'll be on location at Transform Bariatrics in Greenbelt, Maryland, discussing the latest advances in bariatric surgery and how they can help you lose weight and get that shape that you've always desired and improve your health and wellness with one of this area's top doctors, Dr. Hitesh Amin. Welcome, Dr. Amin, to the Top Doctors Interviews program.
Thank you.
All right, we're excited about being here today. We're going to talk about bariatric surgery, some really effective procedures that you're offering here at your practice. But before we get into that, I just wanted to touch on your background. You're recognized as a top doctor throughout the DMV region, also as a top bariatric surgeon, as well as medical weight loss expert. You've helped so many people not only lose weight, but change their lives, Dr. Amin. So I wanted to begin by asking you about your vision for your practice and what you feel separates you from other practices in the region.
Yeah, thank you for asking. And my vision for the practice is simple. I want to help anybody who suffers from obesity and the related conditions. So not only do we want to help them lose weight, but we also want to help them address the other conditions that they suffer from. Things like diabetes, people may develop hernias, joint pains. We're here to help them with all of those things. So we really like to say that we are a comprehensive obesity care practice, not just a surgical practice.
Obesity is an epidemic in this country, probably all over the world as well, especially with the food, the fast food, and just our diets and how we don't exercise, things like that. Can you tell us just how prevalent obesity is in this country?
Yeah, unfortunately, obesity is very prevalent. The latest CDC numbers tell us that nearly 2 in 5 adults in the United States suffer from obesity. And about 10% of Americans suffer from the most severe type of obesity we call morbid obesity. And even those who don't suffer from obesity, many of us still have overweight conditions. So it's actually the minority of Americans that live at a normal body weight. So it is a very common disorder.
And bariatric surgery is something that is a very effective approach to addressing obesity and weight loss. Most people don't really know what bariatric surgery is. Could you elaborate?
Absolutely. Bariatric surgery are a group of operations that help change your body's internal metabolism and anatomy to help you lose weight. Those operations also will help you reverse some of your medical conditions, most notably things like diabetes and sleep apnea.
Some of those are the problems that it addresses. Are there other issues that it can help?
Absolutely. Obesity hits nearly every organ system in the body. So from the brain to your mental health to your skin and joints, obesity affects every single body system. So when you lose weight, you actually see significant improvement in quality of life in all areas. Most notably, your cardiovascular conditions such as diabetes, hypertension, heart disease. But obesity will have such an incredible change in your overall wellness that it can't be quantified with just a few conditions.
There are many procedures for weight loss within bariatric surgery as well. What are some of the most effective procedures that you offer here at your practice?
Yeah, the gastric bypass and the sleeve gastrectomy operations have long been established as very effective weight loss solutions for people suffering from morbid obesity and severe obesity. Patients who have those operations typically lose about 65% of their excess body weight. So as an example, if you're 100 pounds overweight, you lose at least 65 pounds, which is an incredible amount of weight loss. Other operations are equally effective, but we apply those operations on an as-needed basis. Most of our patients will do very well with one of those two initial operations.
And Dr. Amin, those procedures are performed at a hospital, is that right? Or are some of them performed here?
Nothing's done in the office, but typically weight loss surgeries are done minimally invasively these days. So they can be done in a hospital or an accredited surgery center. Most operations these days can be done on an ambulatory basis. So many patients will have their operation, recover in the recovery room, and be home that same night.
And how are some of these procedures performed at the hospital?
Well, minimally invasive surgery really just means any operation with minimal trauma to the tissues. We typically make small incisions that are dispersed across the abdomen, and we use camera and special small instruments to perform the operation on the inside. These days, progressively, we're also using robotic technology to do bariatric surgery. So anybody who has a little bit more of a complex operation or would need that higher level of care would be done at the hospital. However, the majority of patients, nearly 90% of bariatric patients, can be done in an ambulatory setting such as a surgery center.
Oh, that's great. that makes it more convenient for the patients.
Absolutely. So we use a combination of our state-of-the-art ORs and recovery protocols. So we do everything we can to anticipate and correct for any possible side effects or complications of the surgery early on. And we make sure that patients get the follow-up that they need after their procedure. So most patients do very well, recover comfortably at home, and never need to be admitted to a hospital.
And Dr. Amin, are these procedures safe, and how long do they typically take?
Yeah, these procedures are generally considered safe. Complication rates are far less than 1%. Serious adverse events are almost unheard of these days. The operations are done within 60 to 90 minutes with a minimal of blood loss. When patients wake up, they wake up comfortably in the recovery area and typically don't have very many side effects.
To know that the procedures are very safe, the success rate is extremely high, and they can get those great results, it's almost like a no-brainer.
Yeah, if you look at the risks associated with surgery versus the risks of living with your current chronic medical conditions, it's actually safer to have an operation than to continue to live with the effects of obesity.
Wow, and that makes sense because some of those adverse side effects from being obese can lead to not only stroke, heart attacks, cancer, diabetes. There's so many issues that can be associated with being obese. So,
Absolutely. Unfortunately, we know that people who live with obesity, especially the most severe forms of obesity, have a shortened life expectancy due to those comorbidities. So, as you say, if you have diabetes, you're at very high risk for developing cardiovascular disease, and that can lead to heart attacks, strokes, and things that may shorten your life expectancy. We do know that people who undergo weight loss surgery and are successfully able to lose weight actually regain that life expectancy that they would otherwise have lost.
there are different procedures, different options out there that people hear about. What are some of the key benefits of the procedures that you offer here?
One of the most important benefits that people gain are the improvements in their overall quality of life. They move better, they breathe better, they sleep better. Patients who are on chronic medications can come off of their medications. In the long run, as we mentioned earlier, patients will be able to consolidate those gains and live a longer life as well.
And who would you say is a good candidate for these types of procedures? Is it for everyone, or are there restrictions?
Well, anybody who can tolerate an operation can benefit from bariatric surgery. Anybody with a BMI over 30, which is our definition of obesity, can benefit from some type of weight loss intervention. Now, there's not always an option for surgery, but for those patients, we have alternatives as well.
That's where having a practice that offers a comprehensive solution, because you guys not only do the procedures, but you offer support and you offer other types of treatments as well. So it's great to know that your practice here in Greenbelt, Maryland can help people throughout the region, not only in the DMV region, but from further distances as well.
Absolutely. We have patients from all over, not only the DMV region, but also we are now seeing patients from across the country. Patients come to us because we can help them with their weight. We can offer a variety of options. Not only do we help them with lifestyle change, such as nutrition education, lifestyle adjustments, but we can also offer them prescription medications. We can offer them endobariatric procedures, which is a whole new category of weight loss procedures that are non-surgical. So between the variety of options available to us, we can help nearly anybody who suffers from obesity.
What kind of results have your patients been getting from these procedures?
Most of our patients have excellent results. Even if they didn't achieve the weight loss result that they were hoping for, nearly all of our patients have reported improvements in their quality of life. And essentially, that's what we're looking for. If we can help resolve some of their comorbid conditions, help them look and feel better, they do better.
Are the results permanent? Because we know with diets, these fad diets and things, people regain the weight and sometimes even more weight than what they lost. What are the results like? Are they something that can be maintained throughout our lives? Or
Yeah, here's where I have to be honest. The weight loss results are going to be dependent on the individual. Of course, the underlying causes of obesity, if they're not corrected, will lead to obesity again. And of course, even if we are doing everything we're expected to do, the body will continue to age and we will continue to put on weight as time goes on. And that's why it's really critical to have a comprehensive approach and a long-term approach. We expect to see our patients back year after year for as long as they'd like to come follow with us. And if they are suffering from weight regain, we have a tremendous number of options to offer them.
weight loss is a difficult journey for so many people. It's something they struggle with. and regain weight and then try to lose it. They battle that way. What kind of support do you offer here at your practice?
Absolutely, yeah. So beyond just the support that we provide directly at our office, we can refer patients back to nutrition services. We help with exercise, we help with mindfulness. And generally, if patients notice that they're regaining the weight, we can intervene in an early stage to help thwart that weight regain. If patients have regained weight, we offer a no shame, no blame policy. We want to see everybody back, even if they feel embarrassed about their weight regain. We can help everybody.
What is the process that patients can expect when they first contact your practice?
Yeah, we have a dedicated staff who look to help patients gain access to the care that they need. So we have tried to create a frictionless process so that patients can quickly come in for consultation. And whether you have insurance or don't have insurance, our commitment to our patients is to help them get the care that they need. So we do offer self-pay options for those who don't have insurance. We can offer financing. But of course, we work closely with anybody who's going through an insurance process to help them get qualified through their insurance company.
One of the key aspects that we learned from speaking to some of your patients is that you really care about your patients. I mean, they just felt like you were there for them. Not only were you great at what you do, the results were impeccable. I mean, great results. They're so satisfied. But what they were really touched by was how much you really care for the patients. So that was very impressive.
Thank you. I'm honored. I do love my patients, and I think this is the reason why I do what I do. The rewards of seeing their results and how their lives have changed have really just been all the reward that I need.
And what other services do you offer your patients, Dr. Amin?
Yeah, so as I mentioned, we try to be comprehensive. So we know that patients with obesity suffer from a multitude of conditions. Many patients will have gallbladder conditions, they may have hernias, they may have excess skin. They may struggle with their looks, with the weight loss. So we do offer comprehensive care where I perform general surgery operations. We have access to cosmetic procedures for excess skin. And we also have options to help them tighten and tone their skin through a fitness program. Recently, I have worked with a fitness franchise to develop a new studio in this area, and patients can actually go there to help regain function that they may have lost due to their obesity. So the entire program is focused on redeveloping function. It's completely different from other fitness plans where patients may or customers may go there to develop strength and lose weight. Well, we don't need to do that. Patients have already lost the weight. They just actually need to help rehab their knees or rehab their joints or help them move better. So these programs that we're developing are going to be able to help those patients regain that function that they've lost because of their obesity.
Well, keep up the great work. It's truly a comprehensive solution from the procedures to lose the weight, the ongoing support, the emotional support, and even the exercise to strengthen our joints and our muscles and things like that. It was very informative, Dr. Amin, and thank you for being a guest.
Thank you very much for having me.